mentioned immunotherapies, just for the viewers who don't fully understand, because I think the stereotype also with oncology is there's chemotherapy and there's radiation, but you're saying that there's other options for treatment besides just chemotherapy or radiation. There's the medical advances and everything that's happened. Could you explain what the names are of the different types of treatments?
So cancer treatment has historically been about chemotherapy. If you're looking at medications given to treat cancer. So there's chemotherapy, which is not specific to good cells or bad cells, but it attacks those rapidly dividing cells, which malignancies, cancer cells, whole host of side effects on the good cells that are also rapidly dividing. So those have been the mainstay for many, many, many years. And there's lots of interesting stories about how those drugs were used in the past or how they came to be used in cancer treatment. Those are your cytotoxic drugs. This is very general. And then there's monoclonal antibodies in the 90s, started to see treatments for lymphomas, and then also a different monoclonal antibody used to treat more aggressive type of breast cancer, changed the story of cancer care for those patients in those different disease states. Those monoclonal antibodies target specific receptors on cells. So you don't get the same side effects, but they might be given in combination with chemotherapy, which affects good and bad cells because of mechanism of action of the chemotherapy, along with the monoclonal antibodies that are targeted therapies. And then jump way up to the last decade where you see people getting immunotherapy. And those would be drugs that are given to really jumpstart the immune system. Again, very general term, but we know that cancer can trick the body and turn off certain immune responses in the body. So when you give certain treatments, immunotherapy, checkpoint inhibitors, they will jumpstart the immune system. So there are side effects associated with those drugs. But what they can do to help the body fight the foreign invader, the cancer cells, trigger an immune response, jumpstart that immune system, has really changed the story of cancer care over the last decade for populations with lung cancer, for example. So the story has changed. It's been exciting to see all that. Give you very, very general overview of pharmacologic advances and only a little bit of the pharmacologic advances that go on in cancer care. There's oral therapies that are used more than ever, and those can be targeting specific receptors. Those can also be not so specific drugs that are considered cytotoxic and affect good and bad cells as well. So part of being an oncology nurse is having a good foundation on side effect management and being able to teach patients about these side effects and their families. Because at the end of the day, patients and their families carry a large responsibility when it comes to managing their cancer care.
It really helps for you to break that down. And I know you can go into much more detail than that, but I think that was a really good baseline for the viewers, at least.
Life is a winding road, no telling where it goes.